How are you tonight?
Good. How are you?
I'm awesome. Thank you. Thanks for joining us tonight, being part of our Wednesday Living Well with Ovarian Cancer series. So, really kind of digging right into the wellness perspective. We talk all of the time that wellness is an ongoing, proactive way to live your best life. And I really want to hear from you as a gynecological oncologist. How do you feel wellness fits into your work in treating patients to live well with during, after ovarian cancer?
Well, first of all, thank you for having me. And second of all, I think you summed it up great there by saying during, after, before even having, living with cancer. I think wellness is one of those things where if you think about cancer as not being the same for any two patients, wellness is not the same for any two patients either. And it changes over time. So it's different in the upfront setting, it's different during your treatment, it's different after your treatment, and it's definitely different in the recurrent setting. So in each of these arenas, you're gonna see wellness playing different roles, but it's important in each of them. I think it's critical to help with sustaining treatment, to prepare yourself for your mental and physical well-being, getting through therapy. It's just important to help you set expectations for yourself and for your life. From my standpoint, I like getting wellness in there right up front. We talk about the common toxicities of chemotherapy, but people don't really understand what those are going to be or what living with those is like until they experience them. And so if you talk about them when you're getting ready to start your treatment up front, and then you don't readdress it throughout your course or even after your course, then you kind of ignore one of the critical pieces of living with cancer and the toxicities of the treatments and the cancer itself too. Right. We talk about nutrition a lot. We talk about fatigue, neuropathy, sexual dysfunction, menopausal symptoms, I know is a big one, and even interactions with your normal social world. So going through cancer, you're coming to the doctor every day, you have someone you're seeing all the time, and then all of a sudden, when you're no longer on treatment, or when you're in remission, or even a chemo break, it's almost like the floor drops out. What do I do now? Mm-hmm. How do I go back to my normal life? And how can you maintain that or be prepared for it up front so that when you get done, you're kind of ready to hit the ground running? So there's a lot of different ways that wellness plays a big role in cancer treatment.
Do you, are you seeing things like, in your career, there's some of this science-based, are we seeing things that are more anecdotal, that's kind of that applied knowledge piece? I think if somebody's going to Google ovarian cancer wellness, who knows what is going to show up depending on what a search engine is. But talk to me a little bit about your perspective of how you use science and maybe just other information, just as a female, as a mom and somebody who's working and kind of knowing the side effects. Just kind of a little more personal would be great.
Yeah. So it's both. It's science and intuition. There's wellness for everyone. There's wellness that I didn't know about in preparation for my own life as being a GYN oncologist. We kind of have talked about that before, you and mm-hmm. I, kind of what does that mean to me? How do I maintain being a mom, being a doctor, being a student back when I was in medical school, having a dog, having a husband? All of those are part of your wellness and part of keeping yourself the best yourself that you can be. And so, when it comes to science and when it comes to intuition, the thing you have to realize is we're not talking about something that's as easy to measure as, what was your creatinine this week? That's an mm-hmm. easy, very objective thing to look at. When it comes to quality and when it comes to wellness, it's much more subjective. And so probably since 2012, we've been talking about it more in our field about quality of life outcomes. And we started to measure these quality of life outcomes. We're getting more and more data, especially since 2016. But the thing we have to realize is we're just starting to come up with the appropriate tools that allow us to measure these subjective items. And so we're finding that we're tracking and looking at quality of life as a parallel to the actual treatments, but whether or not that impacts from a science standpoint, the person's overall life expectancy, their response to treatment, we're not quite sure yet. Those studies are small, It does look like it may have an impact, but we're just still looking at the bigger numbers are going to take longer to get that information. I think where it comes down to more anecdotal and where it comes more down to like what you've experienced is what are things that can improve your quality of life. And so we do have that now. And so things like fatigue, we have more information on it. Neuropathy, we have more information on it. We don't have as much in pain as I wish we would, but it's coming. And that's why I tell women, don't give up, just keep asking about it, because we're getting more information all the time. You know, when we look at things like diet, nutrition, those things are changing all the time as well. When to actually introduce wellness. Is it at the beginning? Is it after treatment? Is it at survivorship? You know, is it in the recurrent setting? So we're still really kind of working out all those details. Like I said, my anecdotal is the more I can start it up front and even introduce you to the people that can help you when those things happen, so you know who your person is to go to. So you have the tools to start working on it ahead of time. I think that's the best place to start. Earlier is always better in my book. I'm a planner, type A. So if I can plan for something and prepare for it, I feel like I'm way more comfortable with it when it happens.
Yeah, absolutely. And, you know, I love your perspective. It's ongoing. And so what might be important today for some of us, or, you know, may not be the most important priority when it's next week or the week following. So we really want to encourage everybody to, you know, make this an ongoing conversation, talk to your gynecological oncologist, talk to other people that maybe have experienced it, and take that proactive approach to living your best life. Thanks so much. We'll see you soon.
Thank you.